we have a series of 14 patients. And it's not a big series, but hey, find me ophthalmologists who want to have eye surgery, who can come to London. It's not a thing. But here we are. We have 14 eye surgeons between 2011 and 2022. And of course, it's a range between myopia and hyperopia, with cylinder, interestingly, only up to -2. And the age was 40 to 63. And if we're just analyzing hyperopes and myopes together and the mixed cils together, everyone's together here, at 9 months, we have 93% 2020 and 64% 2016. We had here, we had 19% with 1 line loss in this analysis, 0, 2 lines loss. This is comparison to glasses. So basically, 92% were within 1 line of their corrected visual acuity from before surgery. So, you know, more than 90% were almost the same as their glasses, is the way to look at that. And this is the binocular visions? Yeah, binocular visions, yeah. So binocularly, 100% 2020, 83% 2016, and at near 100% N8 and 85% N5. This is a scattergram, obviously, for myopia and hyperopia on the same graph. Nomogram set, as you can see beautifully by Tim, like that, and the stability shows a tiny myopic shift initially because of those are the hyperopes. This is the 75% within a half, 100% within 1 diopter, and the cylinder corrected as such, and maybe perhaps a slight bias, but not in the more or less than 15 degrees cyclic rotation, 7% in each group. So the impact on practices. So as you can see, the outcomes in eye surgeons. These are eye surgeons having eye surgery. So now we have 2 more patients. We got to follow up for another 9 months. We'd like to possibly publish this because, you know, the power of showing that physicians who are offering a treatment would not, you know, consider it to be unsafe for themselves is actually kind of good. And what we've collected over the years is a series of stories from surgeons who have come to the course and have taken their own medicine. Fernand, who came from Belgium, like I said, he was the first eye surgeon to do it before the course. And he came and presented this a year later. So basically, before doing PRESBYOND, he did, what did he say? Well, he was doing SMILE monovision and refractive lens exchange. That's what he was doing, but not LBV LASIK. And now he does all LBV and doesn't do any refractive lens exchange for myopes. His refractive lens exchange is now only reserved for higher hyperopes, because now he's doing much more blended vision. And that was his experience. Christian de Courtin from Switzerland, he was an Alcon multifocal user in Switzerland with about 80 to 100 patients a year. And the year that his cataract volume, this is literally his cataract volume is about 500 to 600 a year. And that's the green line. And but his clear lens exchange was about, let's say, what is that? About an eighth of that, okay? The first year he implemented blended vision, PRESBYOND, the first year he did 6 times the number of presbyopic treatments than he did lens treatments. And that number of presbyopic treatments climbed to 550, while his clear lens exchange rate went down to practically 0. It crept into a few patients in 2014 after the London ESCRS, where the Symphony was introduced and they said there was going to be no side effects, but then that dropped again, but his colleague continued putting them in, but he stopped putting them in. But what I'm showing here is that the cataract volume stayed the same, but the number of presbyopic patients that he treated per year went up by a factor of 10. Because the conversion of a patient saying, I don't want to wear my reading glasses. Yeah, that's no problem. I'll take your lens out and put a plastic one in. Or, yeah, it's no problem. I just do LASIK like I did for your son, and it's the same thing. So, oh, okay, fine, let's do it. It's easier to convert a patient to LASIK than it is to convert them to lens replacement surgery. And the vision's better. Okay, we're not going to belittle that. So, Dr. Russo came to our course a couple of years ago, and he had just set up his practice. He set it up with an Intralase and a Vizix S4 with iDesign, and he was a happy clear lens exchanger, very happy, loved it, came for the SMILE part of the course, left, went back to Brescia, sold his Vizix system, bought the Zeiss Suite, and doesn't do refractive lens exchange anymore. He switched all of those patients over to PRESBYOND, and that year treated more patients than he did the year before with clear lens exchange. He was a very aggressive clear lens exchanger. It was a good part of his surgical load. And he presented this at our, everybody who's attended the course, if you don't have a Facebook account, you can start one only for this reason. We have a Facebook group called, it's a private group, no one else can get in. And you can only get into the group if you've taken the course. Why? Because we want to talk about higher level stuff, esoteric stuff during in the club. It's a grand rounds that we do once a month. Sometimes it's canceled, but usually once a month. And you're all welcome to join. And of course, the video of it's done on Zoom, so the video of it is live streamed, but it's there for you to watch later. If you go back and look at the old club rounds, we have some fantastic discussions about lots of different interesting situations. Dr. Czarnota in Poland, she works in the Optegra group. And like I said, she came to the course, brought several of her colleagues. They came 3 times. And then she started training her own surgeons in Poland. They have 13 clinics. And their refractive lens exchange volume went down, and their PRESBYOND volume in their first year and then second year. So as you can see, again, it's the same pattern. More people having presbyopic surgery than ever had with clear lens exchange, because it's easier to convert a patient to corneal surgery than it is to convert them to lens surgery. It's less invasive, and they've had a wild success in Poland. She told me that they've been growing 20% year on year. And the interesting thing about that is that in the UK, they haven't had the same experience with PRESBYOND, the same company. But there's a different medical director who I think I mentioned thinks that you only need 1 visit, and there's, it changes the protocol slightly. And so I don't know what is meaning, why they haven't had the same success, but I know of that difference. And it just goes to show you that if you follow the letter, you get the same result. Andre Philip, who I mentioned a couple of times, he's the guy who I met in Mexico at a conference. He's from Romania, and he was super happy clear lens exchanger and told me, I have no interest in PRESBYOND. I am super happy with the trifocal from Zeiss. My patients are so happy. I want to come to your course for SMILE. Yeah, the same thing happened, and his volume of PRESBYOND went up. He stopped doing clear lens exchange, and he just sent me that this morning to my WhatsApp. And he says, I'm presenting at the Romanian Society of Cataract and Refractive Surgery right now. And I send a picture of you guys saying, I'm presenting of that right now in London. And so everyone's talking about PRESBYOND. So he says, what does he say? He says, minimally invasive and faster recovery, conserves the accommodation of the lens, immediate wow effect, accurate results, our favorite. Is what I was telling you, right? In other words, this is what's happening. Federico Alfonso, very high volume surgeon in Spain, same thing again. His total number of surgeries went way up because the PRESBYOND kept on growing. And he was increasing the price every year and still getting more volume. So it's showing this plastic bag syndrome where the perception of value is what you need to be looking at, rather than the costs that you have. So 25% increase in corneal surgeries because of PRESBYOND. In 2020, we did this was during COVID. Instead of a users meeting, we did an online users meeting, and I invited 20 surgeons who had been doing PRESBYOND around the world to give 3 minutes each of certain aspects. And I said, you talk about this, you talk about that, you talk about that. So basically we had about an hour and a half of these surgeons who had implemented PRESBYOND in their practices. And yes, there was one in Mexico, correct, Dr. Gil and Juan Manuel, and we had Oscar Mayo down here, and we had Nathan and Christian here. That's right. Is that where Cusco is? I thought Cusco would be a little bit higher. No? Is that where it is? Okay. Anyhow, there we are, and there is a video of this. It's not public, so if you want to take a picture of this QR code, this takes you to the playlist on the YouTube site, and you know, while you're brushing your teeth or something, you might want to watch these 20 surgeons, each with a different story. Some of them had it in their own eyes, some of them, the impact on their practice, how they implemented it. You know, Barbara, for example, her task was to implement it in a multiple clinic situation and to train surgeons to do it in a standardized way and get that kind of buy-in and, you know, have that kind of authority and have that kind of convincing argument that you can get all, you know, it's like herding cats, right? Trying to standardize eye surgeons. But, you know, she managed to get this done, and it's a very good story in her segment. So anyhow, this is the story, and you all know that there are now a number of peer-reviewed publications. There apparently have been over 320,000 procedures now performed around the world in more than 250 centers. So this is now not new stuff. It's not, you're not pioneers. Sorry, you're not pioneers anymore. But you are in the early adopter group because, as you know, at the meetings, 90% of the discussion is on diffractive optics. So we're definitely in a minority in terms of our influence in the community. And I've gone through this whole PRESBYOND system with you today with Glenn, and you know, it sounds like a lot, but actually it boils down to very little. On the marketing side, which I've been asked a few times by you, and so I made a call and I set something up. So Livesey Solar are two Canadian marketing graduates, so like professional marketing people. And I met them in Vancouver when they were fresh out of school 20 years ago. And they were interested in refractive surgery as a specialty in marketing. And they were working for Hugo Sutton, and I asked them if they would come to London and help me in my clinic as I was starting it. And they spent a couple of years with me. And between us, we taught a lot of things to each other because they're marketing experts and I'm an expert at ophthalmology. So we learned a lot about how to promote the better aspects of an individual versus others and USPs, and how do you mark, not, if you just everyone puts we're the best, we have the best equipment, then that's generic. But if you can find a way of marketing yourself, your own USPs, then you become attractive in your own way. And they're very good at identifying that and packaging that. And they're very good, they're experts at SOE, you know, search engine optimization and running all of that sort of thing. So I recommend them. They helped us a lot. And so they said that for the course, they will arrange sort of like an interview if you want to talk to them. And they do have clients in all countries around the world. So it's not, they'll speak English to you, but they can run a marketing program even if it's in Indonesian. Actually, Rod was born in Peru, so he speaks Spanish. But you know, I was born in Peru. You know, I speak Spanish. But anyway, this is a marketing thing. So everybody asking me, well, what do I do about practice development? Well, Zeiss does offer practice development as well, if you are on their books. But they're not going to, Zeiss are going to help you on a cross-sectional way. They're going to come in, give you a lot of pointers, and leave. You can ask them again, I'm sure. Correct me if I'm wrong, Marisley, I'm not sure. But the point here, is it ongoing help forever, or?
Yeah, it's a 1-year program.
Oh, a 1-year program, okay.
And then after they graduate from practice development program, then we come back to support continuously.
Okay.
Not as
Okay, so it's an ongoing program offered by Zeiss. Have a chat with Ron and Laura. They, you know, again, they've been very helpful to us. And that's the end of this section here.